Good afternoon. Welcome to the Health and Wellbeing Board meeting at Leicestershire County Council. Sorry we're a few minutes late. Before we move to the main agenda, I'll quickly confirm the names of those members who have sent in their apologies. So we have John Wilson with Tracy Ward attending as substitute, Mark Powell and Helen Thompson attending as substitute, Simon Barton, Dr. Roe Aberante attending as substitute, Andy Williams, Rachna Vyas, John Sinnott, Barney Thorne being substituted by Amy Ram, and Councillor Kaufman. So we'll move to anybody else? No? We'll follow on to the election of the Vice Chair. So following various changes to the membership of the board, the position of Vice Chair has not been filled since the annual meeting of the County Council last May. Previously, the clinical representative of the board has acted as Vice Chair, and on this basis I nominate Dr. Nikhil Mahatma for the position. Could I have a seconder? Thank you. Any other nominations before I proceed? I take it we're all happy to accept that? Yep. Yes. Okay, you're now Vice Chair. Item 2, the minutes. I propose that the minutes of the meeting held on the 1st of December are taken as read, confirmed and signed. Is everybody in agreement? Thank you. Item 3, urgent items. There are no urgent items, so we move on to declarations of interest. Do any members have any other interests they wish to declare in respect of the items on this agenda? And I will declare a registered interest in agenda item 6, as a member of the LLR Health and Wellbeing Partnership. I presume other members who also sit on the partnership will wish to declare the same interest. Mike?
Yeah, so from me and also for the ICB board as well, I think separately. Yeah.
And also Harsha, sorry Harsha, it's because I've flown in quickly.
Oh, both.
Apologies.
Harsha, yeah, thank you.
Okay, thank you. Next, we have my position statement, and you have had copies emailed to you, and a version's been published on the council's website. My position statement begins with an update concerning local service pressures. Also references the development of the LLR Integrated Care Strategy, the Armed Forces Covenant, the Time to Talk Day conference recently attended by myself and Mrs. Taylor. The new Joint Health and Wellbeing Strategy video, which we'll show you now. The video is a bit jumpy when shared via Teams, but works fine when viewed on normal device. So I think, Victoria, you're going to do that? My name is Louise Richardson, and I'm the Chair of Leicestershire's Health and Wellbeing Board. We're launching a joint health and wellbeing strategy for Leicestershire, and this video will explain who we are and what we aim to do. The Health and Wellbeing Board is a statutory public body. It's the law that every area has one, and the board exists to improve health and wellbeing and reduce health inequalities. The board is represented by several Leicestershire organisations: the County Council, the District and Borough Councils, the NHS, Health Watch, the Police and the Police and Crime Commissioner. We come together to form the Health and Wellbeing Board, and our vision is to give everybody in Leicestershire
the opportunity to thrive and live happy, healthy lives. Creating the conditions for good health and well-being cannot be achieved overnight. Our new strategy is a long-term plan that takes us to 2032. It's an ambitious plan, which we're all committed to delivering together. Our plan needs good data and a strong evidence base, and our priorities are focused on the needs of different communities and the people who live in them. In the strategy, we outline our priorities and objectives, which are providing care and support that is built around you as an individual, embedding prevention in everything that we do, preventing risk factors in the first place, enabling independence, supporting people that have chronic conditions to manage them effectively, including health and well-being in all policies across partners and other organisations, giving equal priority to mental and physical health, supporting recovery from the COVID-19 pandemic, and using a trauma-informed approach, recognising that trauma can have a long-term impact on our health and well-being. To deliver these objectives, we've taken an approach that looks at 4 key stages of our lives, giving children and young people the best start in life, from the first 1001 critical days to starting school and preparing for adult life. Staying healthy, safe and well, enabling people to make healthy choices for themselves to build strong foundations. Living and supported well in the latter stages of life, making sure that frailty and complex care needs are well managed and still focusing on prevention, helping to make sure that older people stay healthy, and dying well. This is a very sensitive area and difficult to talk about, but we need to make sure we understand people's needs at this stage of life and normalise planning for end of life. The journey along these 4 stages will need to adapt to changing needs. This might be health inequalities in a local area or something that affects us all like the COVID pandemic. To make sure this strategy stays relevant and up to date, we'll review it every 3 years and make sure that Leicestershire residents get a chance to have their say. So we will ask for your feedback and then adapt the strategy if we need to. If you want to know more, you can read the strategy on the website, and you can also follow us on Twitter. And if you have any comments, we'd be interested to hear from you by email.
Thank you, Victoria. Just so that you're aware, the ICB logo and the districts are in the process of being added. Before I'm preempting the questions. Does anyone have any questions concerning the position statement? And there's a lot of information there. Mike?
Yeah, thank you, Chair. I don't know whether to ask it now or whether it's going to crop up in Victoria's Health and Wellbeing Strategy Progress Update. But I suppose the obvious question for the video is what happens next with it. So don't know if you want to do that now or are you going to touch on that as part of your paper?
I was going to touch on it as part of the paper, but it is going to be part of the comms plan, and we'll put it on the website and put it out more formally.
Sorry, Nicola, did you have your hand up? Oh, sorry, I thought somebody else did. Sorry, Sarah.
In terms of the NHS logo, we can just have the generic NHS logo that covers all of us. So if it's just the logo for the NHS you want, then it can just be the generic one. If you want to list the partners, then it's all 3 of us.
One other thing that I just wanted to highlight is that we received a letter in from the medical lead of the East Midlands Veterinary Advisory and Pension Committee regarding suicide prevention and awareness for the Royal Anglian Regiment. They've also acknowledged the Royal Navy and the Royal Air Force in the letter, as it's the 10th anniversary of the deployment to Afghanistan. And we as Leicestershire County Council are supporting that. And I would like to hope that other partners will consider, joining the covenant if they haven't, but also adding their support to that letter. Thank you. Item 6 on the agenda concerns the Leicester, Leicestershire and Rutland Health and Wellbeing Partnerships Integrated Care Strategy, which is pages 11 to 46. The report presents the initial draft of the strategy for the board's comments, and Sarah Prima, the Chief Strategy Officer, NHS Leicester, Leicestershire and Rutland Integrated Care Board, will present the report. Thanks, Sarah.
Thank you, Chair. So just a little bit of an overview. When the legislative changes came into effect in July 2020, which established the Integrated Care Board, they also established a Integrated Care Partnership. So the Integrated Care Partnership involves the wider partners within a system, and the Integrated Care Board is effectively the NHS part of the system. One of the requirements of the Integrated Care Partnership, and locally we call that our Health and Wellbeing Partnership, is to produce a integrated care strategy. And this is what is in draft form before you today. When the Health and Wellbeing Partnership were developing their thinking around the strategy, they decided that the strategy should be focused on a few areas, and that it should be focused on the things that would add value by working together across the system. So it isn't intended to be a catch-all for everything that we do. We acknowledge that a lot of things are already in place plans in terms of the health and wellbeing strategies. A lot of stuff will be covered in the 5-year plan from an NHS perspective, which I'll come on to talk about in a moment. And there are also service plans for mental health, etc., that are around. So it wasn't supposed to be a catch-all. So the draft was actually considered at the Health and Wellbeing Partnership back in March, and we agreed that it would come through to Health and Wellbeing boards before we go out for engagement. And I think you have received it as a board already in written form, so we've had some feedback from you already, which I acknowledge and thank you for. So in terms of the focus areas that Health and Wellbeing Partnership agreed on, they're the 6 priority areas that are set out in paragraph 6 of the covering report, and they were the things that we agreed that we would focus on. So in terms of the next steps, so all health and wellbeing boards after today will have received the draft. We're then going to take all of the feedback in, make any necessary amendments, and then we will probably go back, well, we will go for some level of engagement on the plan. The time of that will obviously depend on the pre-election period, but the Health and Wellbeing Partnership have effectively said that their aim is to get this finished by the autumn, by the end of the summer, beginning of the autumn. And if we can do it sooner, then I think that would be good. There will naturally be an alignment between what's in the this strategy and how that gets delivered within the 5-year forward view plan. And the only other thing that I would say is that overall, the priorities were set to allow us to work on things collectively together, not duplicate what was already being done at place or neighbourhood. So it was a layering of actions. So I think I'll stop there, and I'll take any further comments over and above what we've already got, if that's all right. Thank you, Chair.
Thank you, Sarah. And I appreciate comments will be taken on board before going out for engagement. One thing I'm really quite keen on is that we do bump up the mental health side. We did say that it was cross-cutting, but I don't think that comes across in the strategy so well. So, I think I find mental health on about page 26, I think, and it's something that's really high on public's agenda. So I think we should tighten up on that if we can. We also now have a mental health subgroup, so if that can be added to the list. And I am a bit concerned. Some of the collaboratives are going into ICB where I think they're partnership working. So I think it's something we can probably take forward and perhaps work on. I understand how much work's gone into this. I think it's a huge ask to be able to do this. So I think we're just tweaking it really. And I think with it being such a long document, at some point we'll need to do a 1 or 2 page sort of summary or something so that people can have a bit more of a quick, easy read. But that's my feedback. Anybody else want to? Councillor.
Thank you, Chair. I would just echo what Louise has said about the document, if it can be a bit more user-friendly, because not everybody knows all the technical terms and things like that. So that would be my only comment. Thank you.
Thank you. Helen Thompson.
Thank you. I was wondering, Sarah, whether or not, building on the mental health element, we could also strengthen the children, young people's element in it. I think it is referenced at the beginning with the best start for life, but then the examples tend to be adult focused. I was just wondering whether we could pull in a few children, young people's examples, and particularly around where we've got integration. I understand it's not duplicating other strategies, but in the partnership group that Jane and I and Councillor Taylor chair, we talk a lot about the family hubs and how the family hubs will be a vehicle for integration. I'm just wondering whether we could just weave that in, because I think it then bolts the two strategies together that we're working on and makes sense for people that are trying to interpret it on the ground. The final point was just around the system governance. So at Place, and it was only just for my own understanding, so at Place we talk about the health and wellbeing boards and then the integration delivery groups, but we don't reference then the other groups such as the Children Families Partnership in Leicestershire. And I guess you can't get all the groups in there, but it was about, obviously this is it's going to be delivering against some of the things that we're looking at that Place level. So I don't know whether that could be expanded or referenced. Thank you. Thanks, Sam.
Anybody else? Ed?
No, that's fine. Thank you. What was I going to say? I thought of something and then I've forgotten it, sorry. So yeah, I'll come out to you and ask you for some examples, if that's all right, around children's that we can weave in. I think we can do that. That's fine. I'll have a look at the governance, because I think you're right. With this being a system document, we do need to map in those system-wide committees and groups, I think. And the user-friendly thing is one of the things that we're looking at as part of the rewrite, if you like. I will have a look at the mental health stuff and see how we can weave it in. It wasn't identified as a priority by the group because it's in all their documents, but we'll see if we can strengthen the wording around it. I completely agree with you about collaboratives. They are system, they shouldn't be NHS focused. And when we get to the end, we'll try and produce a 1 or 2 page summary. Thank you.
Thanks, Sarah. I mean, I think the mental health, it was across, it's in all 3 health and wellbeing board strategies, and that's where I think we feel that it should be a bit more strong on that. Sorry, Ed, next. Thank you.
Yeah, thank you. And thanks, Sarah. The districts have already submitted a response, so hopefully you've had a chance to look at that. Broadly, we do welcome the strategy. I think the focus areas are right and it's coherent in its thinking. I think the question I had really was just around the interventions. They felt quite focused on kind of a narrow set of interventions around kind of care specifically, and I wonder when it's got some quite broad aspirations around helping people stay healthy and prevention, there's perhaps a broader toolkit of interventions that could be considered, and I just wondered how far the partnership had done that. And I guess I would highlight at this stage that as districts, we are in conversation with the chair at the moment just about representation on the partnership, because we don't have it. And we do feel that's a gap at the moment. We have really good representation on this board through the various work that's happening through neighbourhoods, but there's a gap at the moment on districts being represented at the partnership. So that may be a vehicle to address that in future. But yeah, I'd just be interested in your reflections on the choice around interventions and the kind of breadth that was considered through the partnership. Thank you, Chair.
Thank you. Mike, please.
Yeah, thanks, Chair, and thanks, Sarah. I think most of my points have been covered. I was going to mention mental health and children's, and we've covered a bit about governance, and it is in there about the 3 health and wellbeing strategies. So I think that kind of covers it. The other bit in there that's kind of missing, I suppose, is the link to the community health and wellbeing plans, which is part of Ed's one. Yeah. I was trying to think what the point is, because I don't want to write a kind of a huge tome on how these things join up, but there's just something, if you read it, I suppose you don't want a member of the public to read it and think, where does this fit with community health and wellbeing plans and districts and health and wellbeing boards? So it's kind of in there for the health and wellbeing boards, but it probably just needs a bit of expanding, doesn't it? And then, so if we make those alterations, is that included now, and then the version that goes out for engagement, whatever you want to call it, you know, is that incorporating those, or do we? And I suppose the thought in my mind is, what's your ultimate deadline, and what's the leeway to kind of get something done which ticks an NHS income box?
There isn't.
And then what's the document that we actually believe in, for a better phrase?
There isn't a deadline, to be honest. Okay, it's gone. The deadline was the end of March to get something published. And then they did relax even that deadline a little bit to say, you don't actually need to publish something, you just need to be working on it. We agreed as a partnership we'd get this done by the autumn, so that's the latest date that we are working towards. So we've got time, but I would want to update it before it went out to any engagement. And then depending on the level of update, I think probably the chairs, the 3 chairs of the Health and Wellbeing Board, and David as chair of ICB probably just need a conversation about how do they get comfortable with the version that goes out for engagement. And Ed, I think we'll have a conversation with yourself about how we weave some of that stuff in. But I was thinking, as Mike said, it's probably a lot of it is in and around the community health and wellbeing plans. Yeah.
Thank you. Mrs. Taylor.
Thank you, Chair. Just to clarify, on table 1 on page 5, but page 19 of the pack, page 5 of it, you've got the ICS priorities best start in life. It's best start for life, but that might be running through the whole document. It's best start for life, not best start in life. So you just probably need to check the whole document to make sure that you're.
Okay, there are priorities that have been set for a while, so that's the wording that has been used for quite a while, actually, probably a year, 18 months. So let me just go back to my comms people and have a look at that.
We've definitely got it as best start for life, so it doesn't make sense in life for me. So we should be looking to change it. And my second question is, who's the target audience for this?
So I think the target audience is on 2 levels. It's the partnership, so the system, you know, local authorities as well as NHS, but it needs to be public facing as well.
So I think my point of view, there needs to be an easy read version, because it's not an easy read. We read it because we need to read it and understand it. But if you want the general public to get their head around this, they're not going to read this. So is there plans to produce a very easy read or a simplified version of this for the public to understand?
So yeah, I think it's the same as the 1 to 2 page summary. That needs to be easy read. Yeah,
That's what I was getting at, Deborah, earlier. Anybody else? Thank you. So we've commented on that. I'm pleased that the comments will go forward. Could I just ask, we've got the 5-year plan coming up, forward plan coming up. and that really is meant to be the joint health and wellbeing partnership strategy is meant to be looked at alongside that, but obviously our timescales are not right. So will all the comments that we are feeding in on the strategy be considered towards the 5-year plan? Thank you. So now we move on to item 7, which is the LLR Integrated Care Board's 5-year joint forward plan, which is pages 47 and 48. And this report provides the Health and Wellbeing Board with an update concerning the initial development of the 5-year joint forward plan. And Sarah's going to talk us through this presentation as well. Thank you.
Thank you, Chair. So I just wanted to give the board a bit of context and background, an early look at how the forward plan is shaping up. So I have just gone through the first slide, which is this is the architecture that was put in place at the 1st of July, Health and Wellbeing Partnership and the Integrated Care Board. We just talked about the responsibility of the Health and Wellbeing Partnership for producing an integrated care strategy. The Integrated Care Board have got a responsibility to produce something that's called a 5-year joint forward plan, and it's the plan for delivery of NHS services in a system. Next slide, please. And this just demonstrates a little bit about how it fits in with other strategies. So I won't go into a lot of detail in this. We can send this presentation out afterwards, can't we, Matthew? Next slide, please. Next one, that's right. So there was some guidance issued, Christmas Eve in December, as most planning guidance in the NHS is issued on Christmas Eve. It's always a nice Christmas present for us. And the joint forward guidance said it was a joint plan between the ICB and the NHS partners. It sets out how the ICB and its partner trusts working together with wider partners, because we acknowledge we can't deliver everything on our own, intend to arrange and provide services to meet their population's physical and mental health needs. It does have to take into account the JSNAs and have regard to things like the health and wellbeing strategies from each place. But it also needs to include how we, as the NHS locally, are going to deliver on the NHS commitments and the NHS long-term plan that was published a few years ago. And it also needs to address the 4 purposes that were set out in legislation for ICSs. And the 3 principles that we've adopted as we're trying to develop this plan, it needs to be aligned with the wider systems partnership ambition. So that's aligning it to some of the things that we've talked about today, the health and wellbeing strategies, the ICP strategies, etc. It needs to build on the existing local plans and strategies, but it needs to be delivery focused. It's a delivery plan, it's not a strategy, which is important to note. And there is an expectation that it includes specific deliverables, trajectories and milestones. However, we have been given flexibility on the scope and development and structure of it, so it's down locally to how we structure it. And it will be required to be refreshed every year. Although it's called a 5-year plan, it is going to be, there's a requirement for it to be refreshed every year. And actually, there's also a requirement for it to be refreshed every time the JSNA is refreshed, which I think is interesting because most areas now are not doing a JSNA whole refresh, you're doing parts, aren't you? So we are going to have to work through, I think in the future, not for now, how we manage those things. Next slide, Matthew, please. There's a timeline here, but roughly this has got a hard deadline. So the hard deadline at the moment is the end of June for it to be developed and approved and then submitted to NHS England and published. So at the moment, there was initially a deadline at the end of March to submit a draft, but that has been relaxed now. So we've got between now and June to develop and finalise the plan. In that period, we've got to develop the plan. We are onto that, and we've got to do a level of engagement including discussing the draft with all the health and wellbeing boards, because again, the guidance requires an opinion from each health and wellbeing board as to its suitability to the suitability of the plan. So given the pre-election period, we'll probably be doing that engagement post-May. So we will need to work out with each health and wellbeing board how we make sure we get that through the health and wellbeing boards, whether that be in May or early June. And then in order for us to produce a final for approval at the Integrated Care Board's board in the early part of June. Okay, so next slide, please. I just put a little bit in here about the role of health and wellbeing boards, really, about we've got a legal duty to involve you all, which I've just mentioned. You need to be assured that the draft plan takes proper account and is informed by existing strategies as such, the GSNA, etc. And the plan needs to have a statement of opinion from each of the health and wellbeing boards. And there's just the point there about it needing to be refreshed when GSNAs are. Next slide, please. So this is just a guide. This is just a copy of the guidance, if you like. You can read that at your leisure, but that is in terms of what the relationship between the health and wellbeing partnership and the joint forward view is. The next slide, Matthew, please. So in developing the emerging focus areas, we have considered what the public have been telling us over the last few years from our engagement over a wide areas. We've also taken into account the areas that we think we need to do more on to make us become more sustainable. The aim of the plan effectively is to make sure we become sustainable in terms of finance, quality, performance, etc. within the next 5 years. So the emerging areas of focus are mental health and dementia, LD and autism, right place, right time, right services. So that's making sure that people have services in the service areas that's most appropriate to their need, get it in a timely manner, and improve access. So that's the one where we want to improve access. Management of long-term conditions of frailty and multimorbidity, which we think is really important, particularly in the long term. Integrated health and social care teams, which just touch on the ICP strategy. Women's health has come out as a priority. There's a new women's health strategy that's been delivered, issued by NHS England, and it's quite uncoordinated at the moment, we would say. Quite a bit of work on prevention, and then elective care and children and young people. So they're the focus areas of the strategy. And at the moment, we're starting to put the detail behind each of these areas and what that means. So next slide, Matthew. And then this is the final slide, actually, and it just touches on once we've got a good draft, we'll go out to engagement, touching all of those organisations, and it will need to be in line a post pre-election, post-election period. So I think I'll stop there. It's just a brief overview at the moment because we're still in the middle of putting the detail around some of those areas, but I wanted to give you an early view of what it's shaping up to be in terms of the focus areas. Thank you.
Thanks, Sarah. Does anyone have any comments? Mike Sands, thanks.
Sorry, thank you, Chair, me again. Yeah, thanks, Sarah. As the thought in my mind is there's like at least 3 of those areas: children, young people, prevention, and integrated health and social care teams, where I kind of get it's NHS plans for NHS and partners, but you can't do that without us, be it adults or children's or public health, being part of it. So there's the links with the strategy, but where do we pick up kind of what would be the local authority actions? It's almost like what's the local authority part of the NHS forward plan, if you know what I mean.
I think we need to, so each of those areas are being dealt with through the design group areas. So for example, the children's group or whatever. So we need to link it into there, I think, to come back to the central team so that we can get that input into there. But I'll pick that up with Fractioner and Co as well. I mean, all of those groups got representatives on them, haven't they, from local authorities as well as the NHS. So hopefully the input is going in, but I'll double check.
Yeah, I think you're right. And I guess it's just making certain that there's something that's visible to the ICP or to health and wellbeing boards, just so we can get an overview of it. Otherwise, you're dependent on individual representation in the design groups and the collaboratives, which might be the right people, but might not get the visibility that we all need, really.
Probably me and you can have a conversation as well about how we might do that. Yeah.
I think that's a positive way forward. Thanks. Mrs. Radford.
Thank you, Chair. With the adults head on, that I've asked the team to look at reminding people that they're getting older, to look at what would help them in the long term, rather than leaving it till the last minute and thinking it's a crisis. You know, so if they're having alterations done, think that they're having their alterations done because we're getting older. So, you know, making adaptations if they're having house improvements and things like that. I mean, I've just had a walk-in shower because I know I'm getting older. And when I had a new front door, I had it wider in case I needed a wheelchair. So it was, rather than trying to do it at the last minute and you can't get builders or things in. And it's very difficult. How do you go out there and tell people you're going to get older, be prepared? But it's something as a team that we are looking at.
Thank you. Any other comments? Yes, of course.
So I think that is really important, and I think it picks up on two areas there. It picks up on the prevention bit, doesn't it? And getting prevention embedded into people's minds and acceptance. And also it picks up on one of the other things, which is the integrated care teams. So as part of the primary care requirements for the Fuller review, is that what it's called? We've got to develop integrated neighbourhood teams, and I think they'll become really important in that sort of thing that you've just been talking about, because that's about bringing a number of disciplines together to focus holistically on the patient and or you know, the public. And again, I think prevention is really important in that piece of work as well. So yeah, I think in the 5-year plan we want to have a shift towards prevention that we might not have had before.
Just picking up on the preventative work, in 5 years' time, the local landscape may look very different in respect of things like care technology, adaptations, equipment, etc., that will enable people to live more independent lives and become less reliant on commissioned care. So I think we have to keep a watching brief on all of those things as well, Sarah.
I think this is where probably the yearly update comes in, and the JSNA. Thank you. I can't see any other. Oh, sorry, Nikhil.
Yeah, thank you. Just I guess on Sarah's point regarding the INT. So I think this is I don't think this is a new thing, and it's led by PCNs and the clinical directors along with local authority. And as Sarah was mentioning, one of the areas that will be looked at is prevention, but actually the overall, I guess, goal or aim is to work with local authority to actually address local and kind of neighbourhood level inequalities with healthcare and various other aspects. As mentioned in the Fuller report, I think just one thing to kind of highlight is there's a lot of kind of aims and kind of areas of consideration in the Fuller's report, but I think just to kind of keep in mind, it's yes, it's a good report and it makes sense. However, there will need to be consideration for, I guess, investment in primary care, because a lot of it talks about estates, how PCNs will lead on a lot of this kind of work, how we address inequality, healthcare, all these kind of aspects. But actually, you know, talking about these things is one thing, but actually we need a plan of how we execute that, you know. So I think just keeping in mind how, yes, it all forms part of the Fuller's report, but we've had various conversations regarding how we're going to move forwards with this. But with a lot of the outcomes, it's difficult to identify, you know, the path forwards.
I think this is where the Health and Wellbeing Partnership should be able to come into its own, in that we're going to have to look at how we use budgets more effectively across the board when we're looking at the whole system. And I think we're all in the agreement that prevention is far better than having people ending up, you know, needing help earlier than possibly they need, or indeed ending up in urgent care. So I think that's the sorts of things I'm looking forward to for discussing at that meeting. Anyone else? No, thank you. So we're just asked to note that update, and thank you very much, Sarah. Our next report is to present the Joint Health and Wellbeing Board Strategy Progress Update. This is pages 49 to 66. This report provides the Health and Wellbeing Board with an update on the progress made in the initial stages of delivery of the strategy. So Victoria Charlton, Health and Wellbeing Board Manager, will present this report. Thanks.
Thank you, Chair. So the report, just as the Chair said, is to give an update on the Joint Health and Wellbeing Strategy since the last meeting in December. It's also to give an outline of the development and promotion of the board going forward over the next 12 months. So the board is asked to note the contents of the report and provide any comment to any of the proposals put forward. So just a bit of a reminder as to the last Health and Wellbeing Board meeting in December, members approved to move the performance outcomes report from quarterly to annual reporting, and this was to take into account the fact the indicators weren't always updated at the same time, resulting in little or no change from quarter to quarter. The board also agreed to provide some flexibility around the reporting of progress for each of the subgroups on the joint health and wellbeing strategy priorities, with a minimum requirement of annual reporting sort of put forward. A proposed timetable will now be produced as a suggested forward plan of reporting cycles for each of the subgroups, and this is going to be aligned to the indicators for each of the life course stages when they get updated, and I'll bring a proposal to the May board for approval. So in terms of current progress, the summary of the work achieved so far has been provided by each of the subgroups, and that's included in the report. Just to highlight some of the key points really to go through. So for the Children and Family Partnership, they're going to be due to be carrying out a review and refresh of their 5 priority action plans over the coming months, and seek to align that to the Joint Health and Wellbeing Strategy Delivery Plan. The updated plan will be shared with the Health and Wellbeing Board for approval at the December 23 meeting. Children and Family Partnership have identified 3 priority areas of focus in terms of the Joint Health and Wellbeing Strategy, and work continues to develop in these areas. So the focus will be on priority 1, which is the best start for life, the early years. That's supporting families throughout the first 1001 critical days. Priority 3, which is to support families to be self-sufficient and resilient, and the action plan is currently being revised to reflect some of those current issues and challenges that communities are facing, including the receipt of the funding to support the development of the family hub. And priority 5, which is ensuring good physical and mental health. The partners are working together to identify the impact of the fuel and food poverty is having on families. So work is continuing with Children Family Service, similar services in partnership with Active Together to continue with the delivery of the holiday activities and food programme. And the annual funding of approximately £1.5 million has been confirmed for Leicestershire throughout to March 2025, which is really positive. Wave 7 of the Mental Health Support Teams in Schools programme is underway, and that covers now 50 schools across the county with capacity to support up to 8,000 children and young people. And the Children and Young People Mental Health Needs Assessment is currently being developed and should be ready to present to the Children Families Partnership in March and then brought to the board in May of this year. Moving on to Integration Exec. In relation to the short-term discharge funding, focus will be given to delivering the discharge schemes, which will continue until April 23, and then the valuation will follow that. All schemes across the Integration Exec subgroups are rated green, with the exception of the LLR shared care record, which due to technical issues is showing as amber.
In terms of successes, there's been some real positive engagement from stakeholders across the system, which has ensured the success of the discharge to access scheme. The key messages from the findings will be delivered to the ICB Winter Board and discharge cell in the coming weeks. The BCF target metrics set for 22-23 are on target to be met, and these will be evaluated in March once the NHS England data has been released. So in terms of some of the challenges that have been faced, mainly around the funding requirements, obviously the timeframes are quite short, very specific. There's also been times when the integration team have needed to act quickly to deal with the system pressures, and this can cause conflicts in meeting deadlines. But I know as a partnership they're working together to resolve those. So moving on to the Staying Healthy Partnership. So a lot of the priorities within the Joint Health and Wellbeing Strategy, they're being delivered through the thematic groups that sit within the Staying Healthy Partnership. Health Inequalities Joint Strategic Needs Assessment is currently being developed, and that will really help to provide a real focus on those specific cohorts and vulnerable groups. There's also a number of work streams that are being progressed to address key issues, and they include the cost of living, embedding health and all policies work, and to look at housing relating to the damp and mould issues that we know has been in the news quite recently. Other areas of work that will be requiring further development and progress over the coming months will be around the health inequalities and how that links in with the community health and wellbeing plans, making sure that feeds through. And also looking at the pressure challenges relating to the funding cuts of public and leisure services. And there'll be work to explore how the Staying Healthy Partnership can help mitigate some of that impact going forward. The last update for the subgroup is the mental health group, and that was approved by the board in December to be the 4th mental health subgroup. That subgroup will report directly into the Health and Wellbeing Board, but also link into the system-wide LLR Mental Health Collaborative. The subgroup was due to meet formally on the 16th of February, and they will bring a further update on progress at the May board in terms of priority areas and next steps. In terms of additional updates and developments, as most of you will know, the Health and Wellbeing Board annual report is due. I think it's important that we take a partnership approach and that all members contribute to the shaping and the content of that report. And so one-to-ones have been arranged with all the Health and Wellbeing Board members to encourage that collective voice. Focus will be on where the Health and Wellbeing Board is now, where it sees evolving over the next 12 months, with that particular focus on that place-based leadership. The report is anticipated should be brought to the board in May 23. Moving on to, so in terms of the performance outcomes, just to reiterate, the board, we agreed to move the performance updates from quarterly to annual reporting, but with the caveat that any significant changes be reported to the board by exception. So there have been several indicators that have been recently updated on fingertips, which have caused a significant change in relation to the best start for life and the staying healthy, safe and well elements of the life course. It is worth noting that the data, though, relates to 2021-22, so it's unlikely that the Joint Health and Wellbeing Strategy have made an impact in relating to these changes at this sort of early stage of delivery. The full report is attached at the appendix, but I'll just pull out some of the key headlines. So for Best Start for Life, percentage of children in Leicestershire for 21-22 achieving a good level of development at the end of reception has increased and is actually currently higher than the national average for the first time since 2013, and 16 to 70-year-olds not in education, employment or training to continue to perform significantly better than the national average. But the staying healthy, safe and well element, the trend in the proportion of screening for breast cancer and cervical cancer is significantly decreasing and getting worse, while the trend in the proportion of screened for bowel cancer is significantly increasing and getting better. It is worth pointing out that work has been done to try and understand some of those barriers and enablers to cancer screening in specific inclusion groups, and there has been some work in Charnwood to look at those specifically around bowel cancer. So in other developments going forward is around the communication, engagement and promotion of the board. So we've now got the Health and Wellbeing Board Project Officer now in post, and work to develop the communication engagement capability of the board is underway. This will include carrying out a mapping exercise to identify what's already going out and going on across the area, to identify any joint opportunities and avoid duplication. We're looking at the website and giving that a bit of a refresh and a revamp, also including the joint health and wellbeing strategy, the plan on the page, and adding the video onto that as well. We'll also be looking at utilising social media platforms and increasing our digital presence, so sort of using Twitter. We have a Twitter page, but sort of making that a bit more prevalent. And also looking at undertaking an initial piece of engagement to really understand what health and wellbeing means to some of those communities. You know, have we got it right? We think we know what people are feeling, but do we know? And we can perhaps use that for some of the review of the joint health and wellbeing strategy when it comes up for the refresh. And obviously we'll be working with our comms to develop a comms plan specifically around the joint health and wellbeing strategy, which will include the video and promoting of the board generally. That concludes my update. Happy to answer any questions.
Thank you, Victoria. I think you've been doing really well with the work you've done and the way you've progressed this, to be perfectly honest. We have changed the way we're doing things, and I have to thank the subgroups for coming along with us and you know, getting on board with making the Health and Wellbeing Board the place of Leicestershire. And I know things haven't been easy in all directions, but I think you've made great inroads. Thank you. Anybody wish to speak? Mrs. Radford.
Thank you. I know these figures are for 21, but and it's about the breast cancer and stuff like that. Do we know if they're getting better, the figures, the people going in? I know, I don't know whether you know that yet, or are we still concerned that people aren't going forward to have cervical tests or breast cancer breast tests?
I'm not familiar too much, but I did ask the question because I thought it might come up with some of my colleagues, and apparently the trend is just staying as it is. I don't know whether that's good or bad, but I think that probably a bit more investigation needs to be done.
Right.
Yeah, thank you. Yeah, just to add to that one, and Sarah, chip in if I get it wrong, but I mean, I think the NHS would recognise there's work to do in terms of COVID recovery around cancer screening. So I wonder if that kind of steady state performance is because we still haven't quite got on top of a perceived rump of people across a number of cancers, particularly women with cervical and breast who kind of didn't come forward at the time. But it is one of the priorities around various bits of work to do with health inequalities and indeed the COVID recovery plan in the NHS. So this is probably a very long-winded way of saying the data might tell us one thing, but I think everybody would recognise there's a kind of COVID-related issue which partners are onto.
Sorry, anybody else got any comments? Yes, Tracy.
Just feeding back in respect of the integrated delivery group and the work around women's health, etc., is that some of that screening may not take place because people are of an age where they're also caring for other people, whether that be young children or partners, etc. And I think it's some of the work that we need to do with informal carers, potentially women in particular, around cancer screening, maintaining health and wellbeing, etc.
Thank you. Good, you done? Okay, so we're asked to note that, and we'll now move on to item 9. This is the Leicestershire Healthy Weight Strategy, the implementation progress update, pages 67 to 78. This report shares the Leicestershire Healthy Weight Strategy 2021 to 26 action plan and updates the Health and Wellbeing Board on the progress of actions taken to implement it. Oh, sorry, she's on the Dr. Elizabeth Horton, Public Health Consultant, has joined us virtually to present the report. Thank you, Elizabeth.
Thank you, Chair, and thank you for receiving this paper, and apologies I can't be with you in person. The paper describes the actions being taken to implement the Leicestershire Healthy Weight Strategy up till 2026. And I'd like the board to note the progress that's been made to date and comment on any future opportunities for action. I think it's important to note that this is not all the activity that we are undertaking around healthy weight, but rather the work that's been done in addition to existing commission services. For example, we have existing weight management services run by the local authority and the NHS. We've got the Leicestershire Food Plan that runs in parallel with this, and also, for example, school food provision and work around health in all policies. So what we tried to do with the action plan was to build actions that were partnership actions that were on top of things that we were already doing. Some of the commission work that we do is at system level, for example, the Tier 3 weight management service that's being piloted, and other aspects of the healthy weight strategy are at place and neighbourhood level. And the City Council is also developing a healthy weight strategy, and where we can join up, then obviously we do that. So the healthy weight strategy was approved by Leicestershire County Council Cabinet in March 21, and it focuses on supporting people to have access to healthy and nutritious food, as well as providing services to help people maintain a healthy weight and be more physically active. And of course, this is an important topic, as in Leicestershire, as in many places of England, most adults are either overweight or obese, and a significant proportion of children are too. So it's a real concern, because healthy weight is an important determinant of future long-term condition risk and management. So we've taken a whole systems approach to supporting healthy weight, and what we mean by that is we're looking at actions that we can take to enable the environment to be less what we would call obesogenic. So in other words, things that encourage you to eat more than you necessarily need, or eat food that is not nutritionally helpful. We're looking at so that's one component of the strategy. Then we're looking at the services that are provided to help people maintain healthy weight or lose weight if necessary. And then the third area of the strategy is to focus on the systems leadership. So what are the things that we can do across organisations and in a kind of advocacy and leadership role? So the action plan's attached in the appendix, and so all the detailed actions and progress that we've had over the previous year are included in there. As some kind of high-level examples, for the healthy weight environment, then we have been undertaking food to increase the availability of healthy food in food boxes, in banner boxes, and campaigns around eating fruit and vegetables. But we're also looking, quite a big part of this work is to look at the powers that we have relating to planning and the licensing of fast food outlets and the quality of food that's served in those outlets. That's obviously quite an important partnership piece of work. And in the future, we may also be looking at how we support food in other settings, for example, in hospital settings for both staff and patients. In the theme around supporting people to maintain a healthy weight, we've been looking in particular at improving the referral of children who are identified through the national measurement programme, whether they be underweight or overweight, making sure that there's a good uptake of services to support children through that route. And also we have been supporting the funding, and well, not supporting the funding, supporting the business case to achieve funding for a Tier 3 weight management service that obviously the county residents will be eligible to take part in. We've also increased the breadth of services available in the Leicestershire County Council weight management service to include specific programmes for people with learning disabilities, women who are pregnant, and also men, all of whom tend to engage with services less. In the systems leadership theme, we've been focusing on empowering people to be able to have healthy conversations no matter where they work or where they are in terms of frontline contact with members of the public, and that's healthy conversations training. And also we've been working quite hard to join up the weight management service initiatives in the NHS and making sure they join up with the provision that we have in the local authority and the physical activity provision in the district councils too. So that's a summary, a very high level summary of the actions, but I'm more than happy to take any questions.
Thank you, Elizabeth. Does anybody have any questions or comments? Sarah?
Thank you for that, was useful. I just wondered, given the cost of living crisis, whether there was anything that we are particularly doing differently in relation to that, given that some of healthy foods are quite expensive. That's one thing. And then I just wondered, are we utilising the resources within the VCSE sector at all in this agenda?
So in terms of cost of living, this action plan is the work that's been done over the previous year, and so a lot of what we're doing is about affordable ways to have access to healthy and nutritious food. The food boxes are an example where the food boxes and recipes are provided and help people develop the skills needed to kind of make lower cost meals that are also healthy. So there is a bit of that. I wouldn't say it's a major theme at the moment. It is something that we could perhaps look at addressing for the strategy for the coming year, because it's obviously becoming more and more of an issue recently. In terms of VCS, I think that's a really good point, actually, that up till now we've very much focused on the activities that we as local authorities and the NHS kind of provide and deliver. So I think it is an interesting area that we can look to see if there's further opportunities to work there.
Thank you, Mike.
Yeah, thanks, Chair. Thanks, Liz. There's a lot going on within that. I guess I've got sort of three sort of questions related. First is similar to Sarah's. I wasn't thinking expressly about VCSE, but I was thinking, I suppose the ask is, are you getting all the links that you need into other sectors? So it could be VCSE. I was thinking kind of tourism, food production, and little things like school meals providers. So I suppose there's that. Is there anything you need from other sectors? That leads us on to my second point, which is there anything you need from us as board members to take away and kind of carry on doing this? And then the last one was, again, particularly about the NHS, really, and maybe it's a bit of the partner thing. The funding for Tier 3 weight management is really welcome. But healthy weight, really, thinking about the collaboratives and the design groups, would have such an impact on a number of conditions, and there's always a bit of an issue about capacity, but you're getting all the kind of links that you need in with the collaboratives to push physical activity, healthy weight as part of all sorts, prehabilitation, treatment. You know, it's not just about being healthy to keep yourself healthy.
Thanks, Mike. So in terms of other sectors, a lot of what you mentioned is already covered as part of the work that we're doing with the food plan. So Gavin, as you know, has been working quite hard to look at the business sectors in, you know, for example, in Melton, where there's quite a thriving sort of food festival and food industry, looking at how we can work with them to understand how to make economic decisions and benefits around offering healthy food. So again, I think it's still quite early days, but that is an area that the food plan in particular is focused on. And yeah, I think some of this year has been about just understanding where we're at and as a system, particularly in terms of the wider sector around food. Where are we at? What's available? What initiatives are happening now? What are we doing around fast food outlets and the quality of food? So it's perhaps a bit early. So it's kind of watch this space. And I think if we need to kind of come to the board for more support in those wider areas, then we definitely will do. So touching on that, what do we want from the board? I think we've got pretty good join up now between, because often there's, for example, in the NHS, there's often national money that comes down to deliver things like the digital weight management service. So my plea really is when we have those kinds of funded initiatives, that we do think first about what's available locally and make sure that we join up the pathways. So we've been working quite hard to make sure people referred into the digital weight management service by their GP who are not eligible don't just then say, oh, sorry, you're not eligible, but they actually then get referred into or at least have a conversation about whether they'd like to be referred into our weight management service. So I think we just need to make sure that we do build on what we've got. We've got, so much available locally in terms of physical activity offer, in terms of the food plan and the weight management services, that we need to make sure we join up. And then in terms of the design groups, I think we have good input into some of them, but I'm not sure if it's throughout all of the design groups, because I agree there's great opportunity for example, I mean, it may or may not come into any of the design groups, but if somebody's waiting for a hip replacement or knee replacement and they're overweight, then, why are we not referring them in? Because they'll have a much more successful operation if they can lose weight before they have that surgery. So I think, weight does impact on pretty much all aspects of our health. So where we can build prevention, referral to services that I'd really welcome that.
Thanks, Liz. Ed, please.
Thank you. Yeah, a couple of points. Firstly, Liz, thanks very much for the update. I think it reflects a really positive collaboration that's taking place. I think the breadth of actions and also good to see the breadth of lead roles across different organisations shows that the heavy lifting is being shared, which is really, really encouraging. Just picking up the point around cost of living that Sarah made, there's obviously work I know taking place through the Staying Healthy Partnership and the communities subgroup of that, looking explicitly at cost of living. So if that and they obviously are linking in with the VCS as well. So it may be we just want to make that connection with yourself, Liz, if that's not already in place, but we can certainly facilitate that.
That'd be really helpful. Thank you.
Thanks. Mrs. Taylor.
Thank you. Yeah, just want to sort of throw the children's aspect into this. Obviously, really locality based. Our family hubs that we're creating, this would be an ideal opportunity to join in with them. And also we have our community fridges out in our localities as well. So supporting children and families really about their healthy weight. So I think there's more we can do with that. And also our holiday and food activities that could blend in with that a little bit more. So just a bit more sort of locality based stuff we could do a lot more.
Yeah, and we do, you know, there are members on the implementation group who are also in the children's partnership group. So we do try and make sure that we're not duplicating and that what we're doing in this action plan complements the work that's happening in that action plan. Active Together, we work really closely with, and obviously they're involved in the holiday food programme too. So yeah, again, there's lots of work to do in this area. So welcome any kind of opportunities to join up.
Thanks, Liz. Mrs. Radford.
Yeah, thank you. I just wondered whether or not we work with the food banks, because a lot of the people that go there are, of course, on lower incomes, and the food that is cheap is not usually good food. So I was just wondering, not giving the boxes out, but giving support, say, with recipes, to just simple recipes so that they can use fresh food or whatever, because I am aware that food banks do get fresh food that probably needs eating quite quickly because it's not got a very long shelf life. And just some help with, you know, this is a recipe if you use these and what have you. I just wondered whether or not we work with anybody like that.
Yes, so we have been, food banks is part of the action plan. Firstly, understanding kind of where our food banks are and how they're coordinated, and making sure that there is a good range of foods available in those food banks, because obviously they're often mostly donated food and long shelf life, although as you say there is sometimes fresh food. So really, yes, it is part of the action plan. And the recipe cards, I'm not sure if I probably have to go back and check whether that's a specific thing that we've been supporting, but it's certainly an important, you know, people know, giving people recipes that are affordable is obviously a really important part of that. I agree. But thank you. I'll double check that, but certainly food banks are part of the action plan.
Just a query about, we get a lot of people coming to us saying that they put on weight, they go see their GPs, and the GP then does a referral, but there's this magic number to get into a referral system, and some people can't get the help they need unless they put more weight on, which then defeats the object. So what's been done to help that sort of cohort? And the other question is around this magic number and what cohort or the population it's relating to, because if you think about people from other communities, that BMI doesn't necessarily work for them, and what support is being done to help get that piece of work in, so that people from other communities are getting access to the support they need, because that number doesn't really work for these people.
Yeah, so the way we tend to classify people's weight is by something called BMI, and that's the magic number that you're talking about. So anybody who has a BMI of 25 or over is kind of deemed to be overweight, and then if it goes over 30, it's obese, and then there are classifications of obese higher up. It is those BMI thresholds do exist. So obviously we wouldn't take somebody into a weight management service that was underweight, or indeed a normal weight usually. But for our tier 2 services, then as soon as you hit that kind of overweight, then you will be eligible for some support. Now that might be digital support, it might be access to some weight management support online, it might be one-to-one, depending on your additional needs. We tailor that approach. But actually in Leicestershire, that is available for people who are in the overweight category. The more specialist services, like the tier 3 services, tend to be a higher threshold for kind of BMI to get into, and also they tend to be for people who have need a more multidisciplinary approach, maybe psychological support as well as physical activity. That's very specialised. So there are thresholds for these different tiers. And those thresholds are kind of adjustable, if you like, for different ethnicities, recognising that it needs to be a bit lower sometimes because of different ethnicities. So it is taken into account. What I would say is, that our services do support people of all those different categories of overweight and obese. So encourage GPs to refer people or have that conversation.
Thank you, Liz. Can I just ask a question? With it being the healthy weight strategy, what do we do about underweight and people that are suffering from other, obviously anorexia or going that way?
We steered away from a significant focus of this strategy on eating disorders that led to things like anorexia and bulimia, partly because what the ethos of this strategy was more focused around. We didn't want to call it an obesity strategy because that's quite a negative sort of way of portraying it. It was about encouraging people and supporting people to be a healthy weight. But it did come out of the obesity joint strategic needs assessment chapter, and it was a recommendation from that we developed an obesity strategy, and through consultation we changed that to being a healthy weight strategy. But you're right, there are people who are underweight, malnourished, not necessarily with an eating disorder, and that might be people using food banks. So you can be malnourished and healthy, or indeed overweight. So again, our emphasis is on good nutrition as much as it is about the actual numbers on the scales. We haven't focused in the action plan this time on those, on apart from children who are identified as underweight through the measurement programme. They then get referral letters on to encourage their families to seek support. But for adults who are underweight, if they had an eating disorder, it would be through the usual kind of GP referral pathways as part of this strategy. But I mean, that this was our first year of action against the strategy.
Thank you. Any further comments? Well, thank you, Elizabeth. We note that and carry on the good work.
Thank you.
Thank you. Item 10 is the Leicestershire and Rutland Combating Drugs and Alcohol Partnership, which is pages 79 to 82. This report informs the Health and Wellbeing Board of the progress being made to establish a partnership to oversee local delivery of the National Drugs Strategy. Joshna Mavji, Interim Assistant Director of the Public Health Department, has joined us virtually to present the report. Thanks, Joshna.
Thank you, Chair. As mentioned, the purpose of the report is to inform the board around the progress that's been made. Just for a bit of background, there was an independent review carried out into drugs conducted by Dame Carol Black, which produced a raft of recommendations. This led to the publication of a 10-year drug strategy from harm to hope, which focuses on cutting crime and around reducing harm. And there's 3 strategic priorities that have been developed nationally, focusing on breaking drug supply chains, delivering a world-class treatment and recovery system, and focusing on shifting the demand for drugs, with the outcome specifically focusing on reducing drug use, drug-related crime, and drug-related deaths and harm. In response to the drug strategy, the government has established a joint combating drugs unit, and they've set out several asks for local areas. These include forming a combating drugs partnership, confirming the geographical footprint for the partnership, identifying a senior responsible officer and conducting a strategic needs assessment with the view that would then lead to the development of a local strategy and delivery plan. So in terms of where we are locally, we already have a really strong local partnership that exists. This is the LLR Substance Misuse Community Safety Partnership. And the intention is that this will morph into the LLR Combating Drugs and Alcohol Partnership. The current partnership is heavily weighted towards criminal justice partners, so there is further work needed to increase involvement from health partners. This partnership group will report into the Strategic Partnership Board exec. In terms of the geographical area that's going to be covered by the partnership, it's been agreed that the geographical footprint will be Leicester, Leicestershire and Rutland. The role of the senior responsible officers going to be jointly covered by the directors of public health across LLR. In terms of the needs assessment, each local authority and Leicestershire Police have already completed strategic needs assessments for their areas. So these are currently being combined to produce an LLR strategic needs assessment. So in terms of next steps, still doing a lot of the administrative work around setting up the LLR Combating Drugs and Alcohol Partnership. So we're in the process of developing the terms of reference, the membership and the governance structure. And this is about changing the local partnership that we've already got to make sure that it meets the needs set out by the Joint Combating Drugs Unit and focusing on local need. The other intention is that the local partnership will place an equal focus on alcohol as well as drugs, because we recognise the impact that alcohol misuse has on health and wellbeing across LLR. Another area of focus at the moment is to identify suitable membership from the health sector to ensure that we've got representation from all key organisations. And another key piece of work is to ensure that people with lived experience are involved in the local work, because that's currently a key gap for us. In terms of next steps, we're in the process of finalising the LLR strategic needs assessment that will help to shape our local strategic priorities, and the aim is that will be done within the next month. This will be presented to SPB exec for sign off, and then that's the document that will form the basis of the local delivery plan through the work of the partnership. Happy to take any questions.
Thank you, Joshna. Mike Sands, please.
Yeah, thanks, Josh. I think it makes it makes a lot of sense to build on what we've already got. And there's obviously a load of work that's gone on. Can I just check, because in my mind I had the SPB exec as actually, as being the community drugs, the CDP drugs partnership, because it was the same membership essentially. And then the group underneath in paragraph 8, I had it as more as kind of the working group that took things forward, which then needs NHS representation. So I just want to check we've got the kind of wording right around what we're calling the CDP and what we're calling the kind of the doing group, whatever the better phrase.
So my understanding was that the doing group was going to be called the LLR Combating Drugs and Alcohol Partnership. So yes, it is more operational, but it will be picking up the strategic elements that feed into the SPB exec. So I think part of the challenges is that the Joint Combating Drugs Unit have stipulated certain membership of the partnership. So we're trying to meet that requirement without having to change SPB exec drastically. So I think it's a mixture of both. I think we're going to have the key bit of the delivery, the LLR's Combating Drugs Partnership Group, my understanding is the operational group and will report into SPB exec, but we've got to have a terms of reference and documentation that references that it's combating drugs and alcohol, which obviously with the SPB exec it isn't. So unless I've misunderstood and I've done something wrong, happy to be corrected, but that's the understanding I've got with City and Police.
That's okay. I had it down as kind of, what we do with the SPB exec is we will and we have kind of split it. So there is an element of the SPB exec agenda where Jane hands over to me and I chair that item. So it's almost like it's the same group and the same people, but there's a separate part of the agenda where you'd go, that's the Combating Drugs Partnership, which then leaves the group, the doing group, to be the operational working group, and whatever you call it's fine. I just want to make certain that we sort of get it right. But I'm looking at Jane, she might want to come in.
Jane?
Yeah, Yeah, the SPB exec is the Combating Drugs Partnership, and it needs to sit at that level, so it can't be devolved. There is the right membership around it. We checked it. So around the SPB executive table, we've got NHS representation from across a number of partners. So there's the right representation. That the requirement is that the Combating Drugs Partnership sits at that level and is chaired by the SRO. So yeah, I chair the SPB exec, but hand over to Mike at that point, and it becomes a Combating Drugs Partnership. So I think the group that's referred to in this paper is the operational group that kind of does the do, but the board, the Combating Drugs Partnership, is definitely the SPB exec, and that's what we've shared back with the Home Office in terms of fulfilling their requirements.
Sounds a good way of not duplicating things.
So having done that one, the work in the group that's doing the do is the group that you set out. Don't really care what it's called. When you talk about NHS representation, I think it references the ICP. Do you need more, as in LPT, UHL as well?
Yeah, so at the moment we're missing the NHS the hospital providers. So yes, LPT, UHL, and mental health services, which are quite key to this. We've had the dialogue. We're just waiting for individuals to be identified to sit on that operational group. At the moment, we've got one individual from the ICB, but I guess it's having that NHS provider representation specifically.
Christine, sorry.
It's all right. I've just noticed that I can't see anywhere on there that anybody from the adults is involved. I'm hoping that we do get included. And I mean, I know we have regular meetings with Louise. So as long as the adults are taken into account, because quite often it's adults and that are into drugs and alcohol, which will then affect families. Just my concern.
Can you take that on board, Joshna?
Yeah, we've got that on the list as well.
Thank you. Dr. Aberati? Do apologise if my pronunciation's not right.
Perfect. I just picking up on the provider aspect. So we do have alcohol care team. If you're having trouble accessing them, I'm very happy to link in with that.
That'd be wonderful. Thank you.
No problem.
Any further points or no? Thank you. So we've been asked to note the content of the report, support the arrangements for the LLR Combating Drugs and Alcohol Partnership and its future work, and request that health partners continue to engage in the process of the local delivery of the National Drug Strategy to ensure joint solutions are developed to address drug and alcohol misuse locally, and where appropriate, become members of the LLR Combating Drug and Alcohols Partnership. I think we're all in agreement. Thank you. Agenda item 11 concerns the approval of the Leicestershire Adult Social Care Discharge Grant Submission, December 2022, urgent action taken by the Chief Exec. On the basis that members were previously provided with a verbal update regarding the submission at the last meeting in December, I propose that the report is taken as read. Are there any questions? No? Thank you. So we're in agreement to retrospectively approve the submission. All in favour? Yes. Thank you. Item 12, our final item, concerns the Better Care Fund Section 75 agreement. So it's over to Tracy Ward, Assistant Director within the Adults and Communities Department, to present. Thanks, Tracy.
Thank you, Chair. So the purpose of this report is to provide the Health and Wellbeing Board with an update concerning the refresh of the Leicestershire Better Care Fund Section 75 agreement for 22-23 and seek approval with the continuation of pooled budget arrangements. A couple of recommendations, namely that the work undertaken to refresh the Section 75 pooled budget agreement for the BCF is noted, and that the continuation of the 75 pooled budget arrangement between the County Council and the LLR Integrated Care Board are approved. So just to give you some policy framework and previous decision that's set out in paragraphs 3 through 5, the BCF policy framework was introduced by the government in 2014, with the full year of the BCF delivery being 2015-16. The County Council's Cabinet in February 2014 authorised the Health and Wellbeing Board to approve the BCF plan and plans arising from its use. The original Section 75 agreement was developed and improved in March 15 for the 15-16 financial year and was written on a rolling agreement basis to be reviewed and updated each year. Reviews have subsequently taken place in those years. So just to give you some background, the Department of Health and Social Care has made a condition that the operation of the BCF is subject to Section 75 pooled budget arrangements, where joint governance arrangements between the County Council and the LAR Integrated Care Board will apply. Paragraph 7 sets out that facilitates the commissioning provision of services, and A through E provide some of that context. So paragraphs 8, A, B and C highlight requirements to set out in the BCF policy framework for 22-23, the BCF planning guidance for 22-23, and the addendum to the 22-23 BCF fund policy framework and planning, outlining the need to develop joint plans and use pool budgets, plan for spending budgets in line with the BCF policy framework, and it's a condition of the funding that funding allocated to ICBs should be pooled into the health and wellbeing level BCF Section 75 agreements. Just to give you some context in respect of the agreement for 22-23, that's set out in Appendix A of the document, and paragraph 10 provides the board with the agreement that underpins the BCF plan approved in January 2022 and the discharge grant plan which was submitted for approval in December 2022. The updated agreement continues to focus on financial risk sharing with a default position that the BCF will continue to operate with its own resources and not place additional financial pressures either on the County Council or the ICB. Paragraph 13 outlines the key changes in relation to previous plans, and they're detailed in A, B and C. The resource implications related to the pooled budget arrangement can be identified in 14 and 15 regarding impact and assessment and equalities impact and rights assessment previously undertaken. So paragraphs 20 through 22 covers off the partnership working and associated issues. The delivery of the BCF plan and the governance of associated pool budget is managed in partnership through the collaboration of commissioners, providers in Leicestershire, and the day-to-day oversight and delivery is undertaken by the Integration EC through the scheme of delegation agreed by the Integration Exec terms of reference, and that had been approved by the Health and Wellbeing Board. Any questions or comments?
Anyone wish to comment on that? No. We've been asked to note the work undertaken to refresh the Section 75 pool, S75 pooled budget agreement for the Better Care Fund, and also to approve the continuation of the S75 pooled budget arrangements between Leicestershire County Council and the Leicestershire and Rutland Integrated Care Board. Are we happy to approve? Yes, thank you. Date of the next meeting, we're scheduled to meet on Thursday, the 25th of May, 2023 at 2 o'clock. I have no other urgent items, so that concludes the meeting, and thank you very much for attending.